Are you having a headache? Is your smell erratic? Or perhaps have you lost your sense of smell? Do you have a problem tasting your food? And do you have other symptoms related to COVID, such as fever, cough, and tiredness? Have you ever wondered what would happen to you if you got COVID-19 and you also have these neurologic symptoms? In this video, I will present to you COVID-19 and its associated neurologic symptoms. Hey yo, Dr. Don here. Wait, let's take a break from that which medical YouTuber Ali Abdal calls the British Airways way of talking. He's British, by the way, that's why he calls it that way. Well, actually, it kinda sucks in some ways, but I might do that again sometime if I feel like it or not. Like let's say when I do patient education videos, right? That would do well. So let's cool off a bit and let's talk more candidly, as if you're just there in front of me, and if you'd like to comment to what I'm saying here, then do feel free to type it in the comments below. So how's that for a change? So the main thing that we are going to talk about in this video is concerning COVID-19 and certain neurological symptoms associated with it. Since last year, at the onset of the COVID-19 pandemic, there have already been several published reports about various neurologic manifestations of COVID. And sometime in December of 2020 last year, the German Society of Neurology came up with their own guidelines concerning the neurological manifestations of COVID-19. The link to that paper is in the description below. Feel free to look for it. Indeed, it has been noted that infection with the SARS-CoV-2 coronavirus may be associated with several neurologic manifestations. Among those cited in this guideline include encephalopathy, meningoencephalitis, Guillain-Barré syndrome, acute disseminated encephalomyelitis or ADEM, stroke, epilepsy, chemosensory disturbances, which includes hyposmia or anosmia, which in layman's term is either a deficiency or a loss of smell, nerve and muscle affections, including myalgia and fatigue. In those patients having Guillain-Barré syndrome, which is otherwise known as acute inflammatory demyelinating polyneuropathy or AIDP, the neurologic symptoms usually were noted to appear within 5 to 10 days after the diagnosis of COVID-19. These symptoms range from mild sensory deficits to severe paralysis of all extremities. COVID-19 has also been associated with an increased incidence of cerebrovascular disease or stroke, both of the ischemic type as well as the intracerebral hemorrhage. In several of the case series, it has been noted that the rates of ischemic stroke among hospitalized patients with COVID-19 ranges from 1.6 to 5%. However, it is quite very interesting to observe that the number of stroke patients treated in hospitals has significantly decreased in many places around the world during this COVID-19 pandemic. Why? It is believed that this is most likely due to perceptions of uncertainty of many people. Many of these patients with stroke tend to avoid the hospitals and prefer to just stay home for the fear of possibly getting infected with COVID during their hospital stay. Chemosensory system disorders would include loss of smell, which is known as anosmia, as well as loss of taste, which is also called ageusia. It has been noted that disorders of smell and taste are quite common with COVID-19, and they appear especially in those with mild progressive disease and more often among previously healthy and young people. It is seen more frequently among women also than in men. Among COVID-19 patients, the most common form of affection of the skeletal muscles include a combination of myalgia, fatigue, and elevated levels of the creatine kinase enzyme in the blood. Earlier this year, a systematic overview of systematic reviews. What's that again? A systematic review. No. A systematic overview of systematic reviews on the various neurological symptoms of COVID-19 was published. The authors summarized and analyzed a total of 45 systematic review papers, all published last 2020. Within these 45 systematic reviews, a total of 611 studies relating to the neurological symptoms of COVID-19 were reviewed. In all of these 611 studies, a total of 18 neurological symptoms were described. Among these symptoms are acute stroke, altered mental status, change of smell or taste, dizziness, difficulty in swallowing or dysphagia, encephalitis, fatigue, Guillain-Barré syndrome, headache, issues concerning mental health, muscle problems, neuralgia and polyneuropathy, seizures, disturbances in sensation, as well as sleep issues. The authors of this review were primarily concerned with three main points. First, COVID-19 appears to be getting chronic for certain patients and is presenting in a similar manner to functional neurologic disorder or FND and chronic fatigue syndrome or CFS. Secondly, the long-term neurologic symptoms of COVID-19 may potentially impact on basic neurologic services as well as the overall health care system. And lastly, these COVID-19 neurological manifestations may also affect perceptions of health professionals regarding FND and CFS. When compared with functional neurologic disorder and chronic fatigue syndrome, many of the neurological manifestations of COVID-19 were noted to be quite similar. In particular, most of the symptoms attributed to FND and CFS have been noted to be experienced by some people with COVID-19, especially those claiming to have prolonged and protracted post-COVID symptoms, which is now known as the syndrome called long COVID. In fact, all symptoms of FND except for bladder and bowel issues have been noted in some patients with COVID-19. Similarly, every symptom of CFS except for flu symptoms and heart palpitations were also experienced by some COVID-19 patients. Technically, FND and CFS are what may be called in medical parlance as among those classified as wastebasket diagnosis. And that is a term given to a vague diagnosis in a patient for essentially non-medical reasons, especially in those patients with an obvious but otherwise difficult to identify medical problems despite all the diagnostic tests done. Is it long COVID, FND, or CFS? It is quite important to highlight that there are similarities between the symptoms of this syndrome, now called by many as long COVID, and certain other conditions, especially functional neurologic disorder or FND and chronic fatigue syndrome or CFS. So this brings us to the question of whether the pathophysiology behind the phenomenon called long COVID may be similar to that of FND and CFS. Are they related in some ways, or if so, through what mechanisms? Hopefully, we will all know more about it and get to understand it in a much better way in the coming days. If you like to read more on these papers I cited, I placed them on the links in the description below. In the Philippines, some highly esteemed colleagues of mine did their own retrospective study on the neurological symptoms and associated manifestations of COVID-19 among a total cohort of about 10,881 patients. It was published last month being August 2021, and they dubbed it the Philippine Corona Study. And that's the topic of another video which you can find in the end screen, which is towards the end of this video. That's why it's called the end screen. and which is also linked in the description below. And what about your own experience with COVID-19 and its neurological symptoms? If you have any, do feel free to leave it in the comments below. So I do hope you got great value from this video, and I would appreciate it a lot if you hit that like button below and you share this video with your friends who would like to know more about this COVID-19 pandemic. Subscribe to Neurologs and do click on that bell button so you'll get notified of future videos in this channel. And go buy me a coffee if you want. There's a link in the description below, and that will surely go a long way. So big thanks for staying with me till the end of this video. Stay safe from COVID and see you again next time.